Hey there, we are going live in this video to talk about the Hoover Sign or Hoover test in functional neurologic disorders. And we're doing this because I got a question during our masterclass last week. We did a masterclass for people with functional neurologic disorders, got so many great questions, and I was like, I'm gonna have to do live. So here I am. I see a lot of you on here joining me already. Thank you so much. Thanks for the great question. So, by the way, if we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist and the founder of Re+active Therapy and Wellness in the Los Angeles area. And I care very deeply about functional neurologic disorders. And we did a masterclass last week. The recording is still available if you want to check that out. It's actually on our website now. You can go to reactivept.com/FND and grab the recording of the masterclass. And in that masterclass, we talked a lot about functional neurologic disorders. What is it? How does it occur? We did some great reflections on the underlying systems that could be involved. And somebody asked me about the Hoover Sign. So I was like, we're going to talk about it. What is the Hoover Sign? What is the science behind it? And I'm going to highlight one recent article. It is called Diagnosis and Management of Functional Neurologic Disorder. It's a review article. It is in the British Medical Journal. Is that right? British Medical Journal. Yes, it is. It's from 2022. Selma Ibeck and David Perez are the authors on this, two of the leaders in the field of functional neurologic disorders. This article is phenomenal. It is not a free full text article, but I did share just a portion of the table within the article that this table, by the way, goes on for 4 pages. It has 4 pages of diagnostic tests, positive clinical signs in functional neurologic disorders. Super helpful. And it has a section on the Hoover Sign. So what is the Hoover Sign? The Hoover Sign is a clinical test that we could do as clinicians for a person with a functional neurologic disorder, or really for anybody that we're screening for signs of functional weakness. And particularly only for unilateral one-sided functional weakness. So for example, if a person had a functional hemiplegia, we could do this test and it would help us, it would give us one clue as to if a person has the presence of functional weakness versus weakness that might have been caused. The common word is pyramidal. So I'll say the word pyramidal weakness. Pyramidal weakness is weakness caused by a lesion that's affecting the motor tracts in the brain. So typically an upper motor neuron lesion, like a stroke or maybe multiple sclerosis. So we can kind of think pyramidal versus functional weakness caused by a connection issue in the brain. So it's not localized to the pyramidal tract or the lateral cortical spinal tract, you might say, the motor tracts in the brain. It's the functional weakness localized to connection. I actually did a little history sleuthing on the Hoover Sign. Of course, it's named after somebody named Hoover, right? I wrote it down. Let me see if I can find it here. Charles Franklin Hoover, over 100 years ago, created this to distinguish this pyramidal weakness from functional weakness. And I'm going to show you, actually, I brought Tigger, I have classic Tigger out here to show you the Hoover Sign. So clinicians, this is how you would do it. So we're going to say that Tigger has some functional weakness in his right leg, so his right front leg. So typically when you're testing as a physical therapist, or physicians would do this, I would say, you know, Tigger, lift your leg. And then I would give him some resistance. Okay, you know, meet my resistance. Now, if you have a functional neurologic disorder, you already know this. But clinicians too, if you're working with somebody with a functional neurologic disorder, when you bring more attention to the limb, to where there is weakness, it's going to be harder to recruit any power, any force generation in that limb. Because, and now I'm going to point to Tigger's brain, because of the circuitry that's gone awry brain-wise, that does not allow Tigger to recruit when I bring the attention to his limb. So, what I want to do is, so for example, so we said, let me just show the whole test. I got carried away explaining it. But if Tigger has weakness in his right limb, I'm going to say, Tigger, can you hold that paw down? Right? So this would be similar if somebody was sitting. I'm going to say, hold your leg to the floor. Okay, so Tigger, hold your leg to the floor here. Don't let me lift it up. And so I'm going to try to lift it up. That's his hip extensors. I don't know what they're called in a tiger, but those are his hip extensors. And if he has functional weakness, very likely that's going to be hard, because I brought a lot of attention to his limb. And I'm saying, hold your leg down, Tigger. And I'm lifting it up, and it is not going. It's not staying down. He has functional weakness. So what I'm going to do, I'm going to try to elicit from Tigger automatic hip extension. So what we know in the way our movement is organized is that when we lift one limb, the opposite limb extends. This is how we move and walk, right? So what I'll do, this is the Hoover sign. Now, Tigger, I'm going to just put my hand here. I'm not going to bring attention to it. So I'm just feeling, can Tigger keep his leg down if I ask him to lift his other limb? So Tigger, and he's sitting, by the way, so he's supported on his back legs. Tigger, can you lift your left limb up? And I'm even going to give that limb resistance. Hold it, because the more resistance I give this limb, the more I might feel automatic extension in the opposite limb. So he holds it, I feel it, and he's got a lot more activation. When I am doing a more automatic movement, boom, that's a positive Hoover sign. So again, what happened here is it wasn't distraction. Let me go to your other paw. It was actually, I know how we can elicit automatic movement. I can elicit automatic hip extension by resisting hip flexion. And yes, I already forgot his name, Mr. Hoover. Was it Charles? Charles Franklin Hoover knew 100 years ago that if you do hip flexion in the opposite limb, you can often get automatic hip extension to occur. And the positive sign is when there is a difference between when I bring the attention versus when I bring the attention to the other limb. So that is the Hoover sign. You can do it sitting. You can do it lying down. So we could also, if we were going to do Tigger's back legs, we could have Tigger lie down, and then we do the same thing, holding the leg down to the bed. So for my clinicians, you could do it sitting or you can do it lying down. It doesn't always have to be on Tigger, but he was a good model. Thank you, Tigger. So I'm seeing a lot of questions, so I want to explain some of the pieces here. Number one, this is only a helpful sign if somebody has functional hemiparesis, functional one-sided weakness. This is not a helpful sign if both legs have equal weakness, or both legs are totally paralyzed, or if you have dystonia, or if you have tremor. This is not the clinical test for those things. And in fact, as I mentioned in this article, there was a table of four pages long of all of the different tests of clinical signs and symptoms. We'd be here all night to talk about them, but you know I would probably love that because I love talking about this stuff. But we wanted to focus on the Hoover sign. So it's only for unilateral weakness. And it's not the only sign. So there are other signs, other ways to test similarly in the lower extremity. And here's where you could get creative too. But before we get creative, I want to talk about the sensitivity and specificity of this test. So in clinical practice, we look for tests that can really be reliable to tell us, is this really a positive? Does this really mean that this is functional weakness? And so there's been many studies done on the Hoover sign. And in this article, again, the article is called Diagnosis and Management of Functional Neurologic Disorder. It came out in 2022. They pooled the data. The pooled data found that there is a specificity of 99.5% and a sensitivity of 61%. Now, I don't know about you all, but I always get confused about which one is which. You know, if you're a fellow PT like myself, you had to take statistics and learn all of this in PT school, and I would still get confused. So sensitivity is like your true positive rate, whereas specificity is your true negative rate. And so what that means is that this has a very high sensitivity. So the sensitivity, and I even wrote notes for myself so that I get this right for you. There's a high number of true positives, meaning it is actually true that you had a positive test and they have FND, and a low number of false negatives. So that's what sensitivity is. So the Hoover sign has a very high sensitivity with FND. It has an okay specificity, so 61%, okay. And that means that a high specificity would be the opposite. So a high number of true negatives and a low number of false positives. But what I will say, because I see a lot of different kinds of patients in practice, and I've been in PT for a very long time. So I've seen a lot of things, and I have seen false positives for the Hoover sign. So for example, I've done this in a person with MS and saw that it was positive. Now, actually thinking back, I wonder actually if they also had some functional weakness and maybe I missed it. I didn't know. What I did know as a physical therapist is I knew that when I have somebody flex their hip on one side, it does automatically activate hip extension on the other side. And if you have a person without FND with some pretty profound weakness on one side, that could actually be a really good way to activate hip extension. So that's where I was kind of using the Hoover sign in treatment in a way without even knowing it was a Hoover sign. So I'm tripping over Tigger here. I should just hold Tigger with me. So you have to, with each of these clinical tests, this is why you would never just do one test, right? So if somebody goes, well, they did the Hoover sign and it wasn't positive, I must not have FND. Like, no, there are there were 4 pages of tests. There's like hundreds of clinical tests, just like you would for a rotator cuff. There's not one test that you would do clinically to see if somebody has a potential rotator cuff tear. Very similar in FND, you wouldn't rely on one test. But this test could be very helpful because it's pretty reliable. It has a high sensitivity and a pretty fair specificity. Now, I want to get to some of the questions in here. The last one that I see, ethnicity gardens, always so insightful. Movement becomes more automatic with distraction techniques and you have a better chance to move. So the Hoover sign was not intended as a distraction technique, but you're right in that description there, ethnicity gardens is saying how our brain organizes movement is that we do better with an external focus, with a goal to attain in the movement. And we understand in FND when the attention and when the focus is brought to the limb that is experiencing the symptoms, it often gets worse. And so directing the attention or changing the focus or moving to an external focus will often unlock or open up some of those automatic capabilities. And that is what we are seeing. Ethnicity Gardens says facts. Thank you. That is what we're seeing in FND. So another great question. Do I ask this from a neurologist or PT or both? So here's the thing. As a physical therapist, I don't diagnose people, right? So I don't, if you're coming in without a diagnosis, I can't say that you, for in fact, have a functional neurologic disorder, and I cannot give you that diagnosis. Now, I can screen for it, and I can say you have some signs or symptoms that might be consistent with it, but you will need, and I usually recommend a movement disorder neurologist so that I make sure that there was not something that I missed. So if you're going and you're looking for a diagnosis, you want to go to a neurologist. If you have a movement disorder, meaning you have dystonia, tremor, myoclonus, jerks, tics, you want to go to a movement disorder specialist, neurologist. Great question. I'm going to come up. I saw some other things. So in many ways, just to recap, the Hoover sign is really kind of a test of automatic movement. So for all my PTs and OTs and speech therapists out there, you could think of probably a million different ways to do this that's not just the Hoover sign, right? So you could do something similar in the upper extremities. You could do something and really use an external focus to see if a person has better movement capabilities. And that could also be a positive sign. So what a great question. How does that distraction help with FND symptoms? So again, if you know me, I don't use the word distraction a lot because, and I want to be very particular about this, because it's not that we are trying to run away from the symptoms or even dissociate from them. That's actually the opposite of helpful for you. So what I would like to say instead is that when we are using an external focus or a shift of our attention to another goal, we are actually helping activate the brain networks for automatic movements. And that is what helps FND symptoms for you. So when you shift to a goal orientation versus what's happening in my shoulder, why is my hand trembling? Look at my finger. Let me video it. Let me look at it in the mirror. Look at what my leg's doing. All of those pieces will actually almost like subvert automatic movement. They take away the capabilities for automatic movement, and you've likely seen that. And so a lot of what we do is, it's not that we're ignoring that those symptoms occur. We're actually, we're going to be with those symptoms, and we're going to focus movement on this goal and see what happens. Now, for some folks, they might have functional unilateral weakness and not have a positive Hoover sign. It doesn't mean they don't have functional weakness. But again, I would look at many different clinical tests. Ethnicity Gardens say when I got tested several years ago, nothing moved on my right side. Right. And I will say one of the other things is that I think, again, this is like a really skilled physical therapist. When we're doing this, I'm not even necessarily looking for movement. I am feeling. I'm feeling for pressure. So again, the Hoover sign on Tigger here, I'm kind of pushing up into his limb. This is the weak limb. And I'm asking him to lift up this limb against my resistance. Hold it, hold it, hold it. I'm just feeling, is there more pressure there? If it was super objective, I'd actually measure that amount of pressure, but actually think that would probably bring too much attention to that limb and would not really help the actual test to happen. But I'm feeling versus looking for movement sign. And also a question, can you have FND without the Hoover sign? Absolutely. So many other types of functional neurologic disorders, functional seizures, functional dystonia, functional tremor, myoclonus, functional sensory symptoms. Many of those would not have a positive Hoover sign. So really great question. If you already have the FND diagnosis, is the test necessary? No, it's not necessary. I will tell you what's nice about this is when I'm doing this. So Tigger, you're my patient right now, and we're doing this, and I go, this side is the side that you're experiencing weakness, right, Tigger? And he's like, hoo. I really like Tigger, by the way. I'm sorry, that was so cheesy. So then I go, okay, so I want you to try to hold this limb down, and Tigger's like trying. The more he tries, by the way, the worse it gets, right? And I'm like, okay, Tigger, that's fine. That is very hard for you to activate when I ask you to do it like that. So don't worry about it. Let's do something else. I'm just going to put my hand under here, Tigger. I'm going to have you lift your arm here. Hold it against my resistance. Hold it, hold it, hold it. Wow, Tigger, do you know what happened? Did you sense what happened? And sometimes Tigger or my patient is like, yeah, I could hold it more when I did that. Yeah, or maybe they can't because they can't feel it very well. Well, Tigger, I know you can't feel it, but what I noticed is when we did this, you had more activation here. And that is a sign that there is something, some automatic movement in here, some activation that we can access. We're going to do as much as we can to access that and to get you moving again. So while that's not necessary, isn't that helpful to see, to know in your own brain and body and to have access to? I think so. So this is where having assessment become treatment is really helpful. Mr. Turtle Sandy says hi here. Oh, awesome. Great. Yes, so here's another limitation to the Hoover sign. Thank you for saying this. Ethnicity Gardens always drop in the knowledge bombs. Thank you. Most of the time I was so sensitive they couldn't touch my right side. Yeah, so if you have a high sensitivity to touch or pressure, or you have allodynia, so this like a really painful response to touch, you're not going to do the Hoover sign at all, right? Maybe not even touching either side of the body. And you know what? That's okay, because that's probably not your biggest issue then. The first issue that we need to deal with, or I shouldn't say deal with, that doesn't sound good. The first issue that we're going to tackle together is your sensory system. Let's do that first, and then we can look at these pieces. What a great, insightful knowledge. Minnie, hello. I'm with you. The word distraction is a very hard thing to do. If it's in your trunk, neck, head, yes, contraction happens all day long. And maybe as she's saying, head locks up. Somebody trying to like sing and dance and distract you from that, not very helpful, right? But are there some pieces that you might be able to elicit some automatic movements from? And that is 100% what therapy is. So, I will summarize. We talked about the Hoover sign as a positive sign in FND for unilateral functional weakness. We talked about the article Diagnosis and Management of Functional Neurologic Disorder, Selma Ibeck, and David Perez, who really nicely summarized all of the different clinical signs and symptoms in functional neurologic disorders. And I will share a link to the article and this video in our newsletter. And that comes out on Fridays for clinicians, on Mondays for patients. And you can join that at reactiveeducation.com if you're a clinician, or reactivept.com if you're a patient. And if you are a person with FND, we opened up our functional neurologic disorder membership to the world last week. I'm so excited about this. I see many of you that are on here are in that. I'm going to start doing special lives in that community, and I'm doing one tomorrow. I'm super excited on a brand new article on pain and FND. So this membership is for people with FND. There are learning modules recorded. There's live learning every week. We're going to talk about the sensory system soon. I'm so excited. And there is a support group, there's movement classes, there's a class starting in 2 minutes on nervous system regulation. It's every Monday evening. And there is a very lovely online community. Check that out as well. That is on our website at reactivept.com/FND if you haven't seen it already. I do want to answer this question. If you don't tackle the sensory system first, is therapy not effective? My PT didn't do that. Great question. You want to tackle the biggest piece of the pie. I was saying the sensory system for the person who could not tolerate any touch. That is disabling. It is hard for folks like that to put on clothes. It is hard to move around. It's hard to do a lot of things in therapy. And so you might need to tackle the sensory system first. Now, I will say sometimes the system is so sensitive, we need even other regulation tools. So it might be lifestyle. We need to address sleep first. It might be autonomic. We need to address the person's nervous system regulation through their autonomic nervous system. So we might have to do those things first. And then that allows us to do some of the other motor activities. It's different for every person. So I'm not address sensory first for everybody. Address and get to the biggest piece of the pie for everybody. Yes. Great question. Great question. Yeah, and ethnicity gardens is tortuous being that sensitive. Exactly as I was saying. But even better coming out of your mouth, your words, the lived experience of a person living with that level of sensitivity. And so the Hoover sign, not really appropriate. It is appropriate to look at what things that we might do to help regulate an extremely sensitive nervous system. So we'll have to talk about that one too. But if you're in our FND community, I will see you tomorrow. And if you want to learn more about it, please check it out at reactivept.com/FND. We actually put it on sale for this week. It ends on Thursday. So thank you so much for the wonderful questions. Thanks for letting me have Tigger here show the Hoover sign. And I hope you all have a wonderful night, and I'll see you soon.